Good day, everybody at Retina Charleston, MSO. We are very excited. My name is Eric Elkins. I'm with Double E Insurance and Financial Solutions. We are the ones that manage your group benefits, your health insurance, your dental, vision, life, disability, all that stuff is managed through our organization. And so what this video is all about is to help you have a quick, better understanding of the benefits that your company provides you, which are fantastic benefits at a very affordable cost. Whether you have to pay a little bit or the company pays for all of it, you have some great things here. So I'm going to walk through all the benefits, hopefully to give you a better understanding. And the goal is, if you're watching this, hopefully you're having to enroll in the plan, and this will just help you have a better understanding. So let's start with the health care. The health insurance is with Blue Choice, which is Blue Cross, basically same company. You have two health plans to choose from. The first one, I'll call it Health Plan Option 1, is a high deductible health savings account compliant health plan. This is possibly something new for you if you've been with the company for a while, that you have access to this plan. It has a deductible of $2,750. And if you decide to add a spouse or children or family, you have a family deductible of $6,500. So in this example, this plan, you basically pay at a discounted rate. Everything Blue Cross is negotiated, and you pay out of pocket until you hit $2,750 if you go on as an employee only, or you pay out of pocket till you hit $6,500 after you and your family meet that number. But after that number is exhausted, you don't owe anything else for the rest of the year, including your medications, surgeries. This plan makes a lot of sense, to keep it simple, if you know you're going to have a surgery in the upcoming year. This plan makes a lot of sense. If you don't have anything scheduled, or your family or someone doesn't have anything scheduled, then I would recommend probably option 2. The other piece to the option 1, the high deductible HSA plan, is you can open up a health savings account, which is like another bank account that belongs to you, and whatever amount you put into the health savings account, you get to deduct that from your income. So that's the plus. But again, if you're not going to put money in your HSA, you don't have any upcoming surgeries, don't pick this plan. All right, option 2 is a copay traditional plan that the company has always provided. It has a $2,000 deductible for employee only and $3,500 out of pocket. So the maximum out of pocket for an individual on this plan is $3,500, versus the first plan had a $2,750, which is why I said if you know you're having surgery, you pick option 1. If you don't have anything scheduled, pick option 2, which is a copay. So you have copays of $35 for primary doctors, and then you pay $50 if you see a specialist. So to know whether or not they're specialists, most of the time the doctor's in with ist or pissed. So dermatologist, ophthalmologist, orthopedist, all that is kind of a good way to figure out if they're a specialist. So $35.50, then you have prescription copays. It's pretty standard, great plan. If you want to go on that plan or add your family, then you have a $6,000 total deductible, $7,000 max out of pocket. All right. And then the company pretty much subsidizes and pays for most of it in terms of what the cost is per pay period for you, if you're an employee only. If you want to add dependents, it's still very economical compared to what the market could cost. So those are your two health plans. Now let's talk about what we call ancillary benefits. We're moving your dental insurance from Blue Choice / Blue Cross to Unum. UNUM. So starting in August of 23, you want to make sure that your dentist has your Unum card, not your Blue Cross, because you'll get denied. Your dental insurance is great. It's better than what you had before. You have a $2,000 annual maximum allowance. So if you go in for major stuff, they're going to cover pretty much up to $2,000 for you. If you add a family member, they get $2,000. Everyone gets $2,000. You get 2 cleanings per year. They're free. That's preventative, so it won't cost you anything to go in for cleanings. So you should keep your teeth nice and clean. Also, it helps with your health. Vision. That's moving from companion to Unum. Again, everything's going to be with Unum starting in August of 2023. Great vision plan. Also, let me walk back. On the dental insurance, that's 100% paid for by the company for you as the employee. So there's no reason not to enroll because it's free to you to be in it. Vision, again, is moving to Unum. You have copays of $10. You have allowances of $120 for contact lenses, which you can use that allowance once a year. And if you want to buy new glasses, you can use that every 2 years, $120 allowance toward frames. The network is iMed. Very good network. Shouldn't have a problem going to see who you want to see in terms of optometrists, ophthalmologists, etc. And that's a small fee to go into, which is less than what it was when you were with Companion, depending on which tier you select, whether you go as an employee only or family, etc. You have short-term disability. That's with Unum. That kicks in, God forbid you got sick or disabled, that kicks in after 8 days. If you're still sick or disabled, it kicks in 8 days later, and it's going to pay 60% of your weekly earnings. So if you make $1,000 a week now, it's going to pay $600. Up to a maximum won't pay more than $1,500 a week. That is 100% paid for by the company. It's a great benefit. It continues for 13 weeks after you got sick or disabled. So really, basically, it's protecting your paycheck. If you're, God forbid, still sick or disabled after 13 weeks, then you have long-term disability, which is also 100% paid for by the company, that would kick in. And that will pay 60% of your monthly earnings up to a max of $6,000 a month. So the difference between short-term, that's paying 60% of your weekly earnings. Your long-term is paying 60% of your monthly earnings up to $6,000. And that will last until you hit Social Security normal retirement age, or you got healthy again and you're not sick or disabled. Again, protecting your paycheck, but the company's paying for it. So awesome benefit that the company, again, is providing 100% paid for short-term and long-term disability. God forbid you pass away while you work for the company. The company pays for a $10,000 life insurance policy on your behalf. So you don't pay for any of that. If something happens, $10,000 will be paid to your beneficiary, and they can maybe have a party with that money or something, because I don't even know if that buries you anymore, but it's $10,000 that you didn't have before. So another great benefit. You have this year in 2023 voluntary life insurance. So if you smoke, you drink, you overeat, you indulge in something more than you should, you're not that healthy, you're diabetic, you have a history of cancer, whatever it is, it doesn't matter. You can get up to $100,000 without any questions being asked of you. Nothing. So they won't ask you anything about your health. You can get up to $100,000, no questions asked on you, and your spouse can get up to $25,000 with no questions, and your children can get up to $10,000 with no questions. Basically, this is a great benefit. If you have a family or you have a need for life insurance, it's extremely inexpensive because of the deal that the company worked out on your behalf to get you these rates. So as an example, if you were between the ages of 45 and 49 years old and you wanted $100,000 on you, it would only cost $3.50 per month. Again, that's per month. It doesn't cost much. So I would take advantage, especially while you're insurable. The next option outside of the voluntary life is what we call worksite benefits. Again, all of this is through Unum. You have an accident policy that is voluntary that you can elect. So if you have a tendency to fall or break bones, or you have a child that is kind of active and potentially breaks bones, etc., or gets into some accidents, whether life-threatening or non-life-threatening, the accident policy is a great investment. It, for an employee only costs $5.45 per pay period. If you wanted to add it, for example, to your family, it's basically $17.99 per pay period, and that covers everybody if you wanted to do that. It also has a $50 wellness benefit where they'll reimburse you if you went and got a physical, or your family did. They'll reimburse you $50. So it didn't really cost you the numbers I just mentioned. But as an example, if you had an accident, such as you had a concussion, it would pay up to $200. I know about concussions. I have children. I have kids. Their heads get banged up, and then they get called for a concussion. The company will send you $200. If you got burned, if there was an ankle, for example, if your ankle bone or bones of the foot were dislocated or surgery is required, it'll pay $1,650. There's a huge list of things that it'll pay toward in regards to accidents, and it doesn't have anything to do with being on the job. So great benefit if it makes sense for you. The next one is critical illness. That's another voluntary benefit that you can elect. Critical illness is where if you had a stroke, heart attack, you got cancer, you got Alzheimer's, Parkinson's, all these critical illnesses, if they were to happen to you, it's going to lump sum pay you potentially $10,000. Write you a check for $10,000. At least that would be the bonus of having one of these, God forbid, things happen. So that's a benefit you can elect for yourself as well as for your spouse. And you could get it on your kids, but I don't necessarily think it's some great option, because it's probably the odds are they're not going to get those events, hopefully, knock on wood. Last option that you can elect is hospital indemnity. This helps cover that deductible that we talked about earlier on one of those health insurance plans. So if you went into the hospital for surgery, then you could get potentially $1,000 or a sum of money sent directly to you to help pay for that cost, even though your health insurance has its out-of-pocket that you're just going to basically get money back, and it could potentially cost you nothing for the surgery if you elected the hospital insurance. Again, not expensive, $5.99 per pay period. And every one of these ancillary benefits I just described are not expensive. They're great benefits. Don't forget, the company pays for the majority of your health insurance for you. The company pays 100% of your dental insurance for you. They pay 100% of your short and long-term disability for you. And then they pay $10,000 life insurance. So you don't have a lot of out-of-pocket because the company is so generous. Take advantage of these benefits that will cost you a little investment but can provide a huge return. God forbid any of this stuff happens. And the good news, if it never happens, that's a good thing. Hopefully you did throw the money away because you're healthy and safe. That is the summary of your benefits that you can elect. If you have something called Employee Navigator that you go on and you enroll online and you pick what you want, it'll walk you through it. Take advantage of this. Enroll today. Enjoy your time at Retina, because I promise you the grass isn't greener at some of these other practices. They are giving you an excellent benefit. They're not paying me to say it. I promise it's true. I'm Eric Elkins. Have a great year.